Hey, it's Mickey with Motion Restoration. So in today's video, I'm going to be showing you how to massage someone who is suffering from shin splints. So this condition can be quite painful, so definitely check in with your patient when you are doing this massage to always make sure that you're not performing too much pressure for them. Now, I always like to start my patients to be face down and then turning over to face up. So what I want you to do is go grab yourself some lotion with a good amount of glidability or some coconut oil, and let's get started. All right, so we have our patient lying face down to start. And if it's within your scope of practice, you want to make sure that you are opening up the hamstrings so we can allow a lot of the swelling that is happening within that tibialis posterior, that's the pain for those shin splints, to make sure everything is going to be draining through the leg. So if you are within the scope of practice, open up those hamstrings, and then let's get into these calf muscles to start. So we have our lotion with a good amount of glidability. I like to start at the ankle down here and just a nice firm pressure using the palm and the heel of my hand going up. So just doing a few of these passes. So if you notice that when you are doing massage for shin splints, they're quite warm. You're going to notice that the muscles that are affected because of the amount of swelling, the calf and the shin are going to feel quite warm. So note the areas that do feel warm and really kind of focus on pushing with your palms and push that extra swelling upwards. So I like to go nice and slow so I can really feel the areas that are affected when it comes to massaging anything in the body. So I like to take my time, really feel the muscles. So next up, what I'm going to do is we're going to go to each individual of the gastrocs head. So again, with that heel of my hand, I'm just going to be pushing into the medial head of the gastrocs, nice and slow. So we're just trying to loosen up the muscles that are on top that can also be affected. So we want to get these guys to calm down and relax as well. So a few passes on the medial, and then we're going to go with the heel of the hand onto the lateral head of the gastrocs muscle. Next move that we're going to do is again taking the heel of that hand. I'm going to push up on both sides, and I'm just trying to get in between the soleus and the gastrocs. So I'm just trying to go up that tendon, and I'm just pushing the heads of the gastrocs up and away. And then when I get to the top, I'm scooping them up with the heel of my hand. So I'm kind of doing a circular motion, so up and towards the knee, up, towards the knee, up, just like this, and we're working our way down. So we're really trying to just scoop up the gastrocs muscle. So same thing, another pass of that. So up, up, and up. And then flush it all upwards. All right, so the muscle that is being affected is actually really deep inside the calf muscle. And the best way to access it is actually through the medial aspect, but I also like to go deep through the heads of the gastrocs muscle. So for that, I'm just gathering some more lotion. So I'm going to follow the Achilles tendon, and I'm going to be pushing on that a little bit deeper. So we're not digging in deep. It's just a good firm pressure, and I'm using just the pads of my thumb. We're following up that Achilles, nice and slow. And our goal is to get to in between the two heads of the gastrocs muscle. So you can start to feel them separating. So that's what I'm aiming for, is just going in between. I'm just separating the two heads all the way up. And then you can feel the two heads slowly start to separate. So that's where you want to release your pressure. We're not going to be going deep into the back of that knee. So releasing the pressure right around here, and then I'm just going up to the two heads and then back down. So I'm going to be doing a few passes with that. Each pass that I am doing with this, I am going in deeper. So now I'm going to be going a lot deeper. So this is where you want to check in. How's the pressure? How does it feel? Do I need to back off or can I go a bit deeper? So if we want to get into that tibialis posterior muscle, we are going quite deep. So I like to do this. You're going in to do a couple of passes, but you are going in a lot deeper by at least the third pass. And again, if it's within that scope of practice, use your elbows and get in there with your elbow. So again, this is our third pass and I want to get in quite deep. Go slow with this. You do not need to speed up and rush through this. You want to go nice and slow. Feel for restrictions, feel for heat, feel for pain. There we go. So each of these moves I typically will show 2 to 3 times, but doing them more repetitively and really trying to calm these muscles down will help out. So for time's sake, I'm just going to show you kind of the quick ways of getting into the calf muscles. But of course, if you are a massage therapist, use the techniques that you have in your tool belt to relax these calf muscles as well. And now I'm going to get my patient to flip onto his back and let's get into the shin. So now our patient is going to be lying face up. So we're going to apply more lotion to the shin on both sides. All right, so the main area that is going to be inflamed is going to be on the inside of the ankle up here, the medial aspect. Even if they're feeling pain that is along the shin, it is the muscle that is actually on the back of the shin bone that is starting to pull, and that's where we're getting that pain. We still need to focus on that tibialis anterior, that big muscle that's on the front here. So let's get started with this guy first. What we're going to do is you can either go thumb on thumb, thumb beside thumb, or you can use your fingertips and reinforce those. It's whatever is most comfortable for you. So we're just going to be going just to the side of that shin bone all the way up. So it's whatever works for you. So we're pushing just to the side of that shin bone. Good firm amount of pressure going up here. And then what we're going to do is you're going to take your thumbs. Again, you're on that side of the shin bone and I'm just pushing and I'm scooping down, pushing the tibialis anterior off the bone. So I'm going to work my way down, tibialis anterior, and I'm just pushing it off the bone. Still pushing it off the bone, just working my way towards the ankle. Then another pass up, tibialis anterior. Nice and slow, feeling for those areas of tension. All right, so now we're going to get into the fun part. This is the part that can be quite painful for people. So we're going to be going, we have the bone here, which is our medial malleolus. We're going to be going just above that. So we have the giant shin bone here, our tibia. So what we're going to do is you're going to push where the tibia is, and then we're going to push in. So I'm kind of, it's hard to explain. So it's going to be in, but I'm also going up along the bone. So I'm kind of scooping it up and pushing as I go up, keeping that firm pressure. So if it is way too painful, back off and just do some light kneading, which means just taking the pads of your thumb and you're going to do nice circular motions just along the bone here. So if someone is suffering, it's very acute, it is quite painful, then I want you just to kind of focus more on getting the swelling out of there than the actual releasing of the muscle right now. So again, we're behind that malleolus. We're going to dig in and we're going to go up the shin, just like so. So digging in nice and deep. You can even go reinforced thumbs. So as I'm going in, again, I'm just hooking my thumb onto there and I'm pushing from the bottom. So we're getting in there nice and deep. And then the end of every massage, flush everything up towards the heart. So I want you to do a lot of flushing with shin splints. I really want you to help to try to decrease a lot of that inflammation that is in there. We want to promote a lot more circulation coming in. So push away all the inflammation, bring in some fresh blood and help it to heal itself. So that was just a very quick demonstration of how you can massage someone who is suffering from shin splints. Now, if it is within your scope of practice, make sure you are opening up the hamstrings as well as the quad muscles. If it's not within the scope of practice, just do a couple of passes with the lotion just to help to open up the ways, so then it'll help to decrease the swelling that is happening within that shin splint. If you're finding that you can take a little bit more, add a little more pressure. If it's too much, back out. Again, that first stage of acute, you're looking to just help to decrease the swelling. So you might even just be doing passes of light movement just to decrease the swelling within the shin, and then work your way into a deeper massage to help to stretch out those muscles, to help to bring in extra blood, extra oxygen into the area, which also helps with healing. So hopefully you found today's video to be helpful. If you have any suggestions for future videos, please feel free to leave them down in the comment below, and don't forget to like and subscribe. We'll see you in the next video.